All right, then, let's go to our next story. For as long as the COVID-19 contagion continues to devastate mankind, for that long would we pay for disobeying simple safety protocols recommended by the World Health Organization, WHO. The Nigerian Center for Disease Control, NCDC, has let it be known that the country recorded as many as 10,000 inbound passengers, or if you like, travelers, as of 22nd of January this year. Dr. Ifedayo Adetifa, Director General of NCDC, says repeat tests has become mandatory based on the review of COVID-19 test positivity data among returnees to Nigeria during the first and subsequent waves of the pandemic. Meanwhile, WHO wants countries to lift travel bans as the bans are not effective against the spread of the pandemic. Paul.
That's true, because if you look at the spread of the disease, the rate of increase, it keeps increasing all over the world. It's only in Africa, according to WHO, that the rate of infections has dropped. I think they said it has dropped by a third or something.
Surprisingly?
Surprisingly. So I think people have got to rethink their strategies. Now, in Nigeria here, part of our problems is that we don't, I think people are very cynical, very skeptical when it comes to, because sometimes when I go to the Facebook page of NCDC, I see people laughing, mocking NCDC when they come up with their new figures. They just keep laughing. Some people just
they call it scores.
But the thing is, there's this book that's titled, exactly, there's this book that is titled, What You Don't Know May Be Killing You. You see, people die slowly, people die without knowing. I think what we need to, I agree with the NCDC, this mandatory, the repeat test and all of that. But beyond all of that, everybody needs to take responsibility for themselves. People are still dying of COVID-19, that's a fact. People are dying of Omicron, people are dying of COVID-19, and we don't know who next. Now, we need to talk to ourselves. Let us be responsible for ourselves, and let be responsible for the fellow.
And let God look after all of us after we are done our bit.
Exactly. You have to play your own part. That's the truth. You have to play your own part.
Jide, my mind quickly races to Australia and the Novak Djokovic saga because of what do you call it? Taking the jab or not taking the jab and so on. And the man was asked to leave the country.
Yes.
So that, and we are talking about inbound travelers.
I really don't get the point that the WHO
is trying to
make. This contagion spreads fast through air travel. That was how, if, for example, travel from China to other parts of the world had been stopped early
initially
enough, yes, we would not have been in this mess. It was this same WHO that were telling us that no, this thing had not reached the level of an epidemic, that we should not
go to town yet.
Yes, that the travel ban was not necessary at that time. You can't tell the Americans now that early travel ban, as it concerns movement to and from China, was early enough, because at the end of the day, a lot of the Americans who travel a lot, especially in cosmopolitan states like New York, they have suffered for this thing. And you can see more than 862,000 Americans are dead already. So I wish we had taken some steps earlier, and I wish the World Bank, the WHO, had not even misled the world. Because I saw one of the president, I think one of the world leaders, I think from Australia, even castigating the World Bank, that at the point when it was suggested, let's put travel ban in place in China, you opposed it. Now see what we are going through. So this situation now there is still no better way to put this matter in check without addressing the issue of travel
bans,
air travel. Now, look at what countries like Rwanda, even the UAE, they are very serious about this thing. Nigerians are now that we are talking about the need for a second test. Of course, if you like, do 1 million tests in Nigeria. If you are getting into UAE, that is if they even allow you to get into their country, you are going to do another test. Nobody will simply go to bed believing that your test that you have done in Nigeria means that you are clean. At the point, even at the airport, when you are mingling with people, you could still be infected.
Yeah.
So as you are landing in their country, even if you have you have a certificate indicating that you've had the PCR test, they will still subject you to a fresh test. That's the way it should be.
Let's talk about us.
That's what I'm saying. That our country, no matter what anybody's brandishing, no matter which country of the world he is coming from, we should subject them to a second test when they get here.
By us.
Yes, because that's what they do to us elsewhere.
Yeah.
Even if they've taken the jab, you should still test people. Countries that are serious about this is what they are doing. In our own case, they subject our people to those multiple tests. Yet in our country, we don't want to do it, and people are coming into our country bringing this contagion into our country.
It's crazy.
We've got to do
what
something.
we do to ourselves.
Yes,
it's crazy. What
we are doing it to ourselves, because even people come and they don't do tests, and they
get fake certificates.
What is wrong with us? It's like sometimes we want to blow up this country ourselves. We want to destroy this country as if we had another country. You know, when I look at politicians, when I look at religious leaders, they are not showing example. Look at what happened with Boris Johnson.
Yeah.
His office organized a party breaking COVID-19 restrictions. All hell was let loose. He had to apologize.
Yes.
People do it with impunity here. Nobody talks.
And nothing happens.
You have political gatherings, you have religious gatherings. They will say, God will bless you, God will heal you, God will cure you. Is God that foolish? Why can't we help ourselves? Is God a magician? Is God?
You willfully you willfully do what will subject you to tremendous pain, and then you expect God to come out.
It's like you are tempting temptation to tempt you. You are troubling trouble.
Well, if there was no God, I get the impression Nigerians would create one and program him to listen to them. It's crazy.
If somebody once said that if Nigerians had a chance, they will bribe God.
Then go vote money for him.
Yes, now. They think it's like the rest of us. You see things happening in other countries, worthy examples about true governance, not misgovernance. You refuse to take those examples. It's the negative examples that you'll be talking about.
But
why can't we, the sort of thing that happened in respect of Boris Johnson, why can't we do it in our country?
I mentioned
who is that person that will try
Novak,
to do it here?
The world #1 tennis player.
Yes.
Novak.
Why did he lie? He misled them.
No.
He misled them.
We have a responsibility.
Overwhelmingly, the judges voted that you must be deported.
You know,
they know they look face now,
and the game is on.
Yes,
without him,
3 years.
We are star-struck people. We are celebrity-struck people here. We don't allow institutions to become stronger than individuals.
Yeah,
you know, and we are using.
We are very strong individuals.
Exactly,
the untouchables,
and it should not be like that.
We have the untouchables in this country, and they are in their millions. And you hear things like, I go do am, nothing go happen.
Nothing go happen. That's why they happen.
And they are right, too.
And then once you have money to grease the palms of certain people at the airport or anywhere, you are allowed
to let you go.
They let you go.
Let you go.
Without even thinking that the person that may be infected may be the brother or the sister of that person that let you go. It's possible.
Citizens, we are just fortunate. South Africa, out of 3.57 cases, they recorded 93,946 deaths. America, out of 69.3 million cases, they've recorded 862,000 deaths. India, out of 38.6 million cases, they've recorded 488,000 deaths. Brazil, out of 23.6 million cases, they've recorded 622,000 deaths.
I beg, add Nigeria on there.
It has pleased God that our case is not really bad. When you compare our case with all of these countries, you know that we have not.
But you must also agree we are very poor at keeping figures.
No, if beyond that, if our case was this bad, nobody will tell you.
No.
We don't have the health facilities to support. If this thing becomes a real epidemic in our country, a real contagion, we do not have the health facilities to support. I mean, to address the problem. How many? We don't have sufficient oxygen when it becomes an emergency. We don't have
ICUs,
it. So we'll be picking people on the
missing.
streets.
How many ICUs do we have?
How many health centers do you have, especially in the rural areas? How many do you have? You go to some local governments, you are supposed to have primary health centers in every electoral ward. That is everywhere people line up to vote. You are supposed to have. That was the design, but we have refused to implement the plan.
If you implement the plan, Jide, money no go reach now to share for the boys. No vex, so I just rub that one in.
Okay.
Yeah.
You know there are. You know me that when I'm angry like this.
No vex.
Some of these jokes, you get as they do.
Jide, life is short. Don't make it shorter. We have had things that would shorten life more than enough in this country. Paul, let's bury this by saying it is not too late to do what is right.
Exactly.
Never too late.
Exactly. It's not too late.
Look at the figure, 18,000?
Yeah.
10,000 inbound travelers.
There was even a report that said 18,000. The report I had was 18. I don't know. I saw
there will be more than that.
Yeah, they will actually be more than that.
Some of them will even. They won't provide their contacts. They will give you fake contacts, so you can't trace them.
Yeah.
All because they just want. And it's Nigerians doing this to fellow Nigerians. You are endangering the lives of other people. You give them fake phone numbers, give them fake addresses, so that no one can trace you. You know.
All right then. As we say here, the debate can continue, but we have said our bit. We leave the rest to the policymakers. Good luck.